I am a urologist, and I've been in this field of sexual health since my training. I finished my residency in 1998, and that was right when Viagra was getting FDA approved for men. And I happened to be the only woman in the Department of Urology at that time. By the way, there are more and more women going into the field of urology now. At the time when I was coming out, there were probably maybe 110 to 120 board certified. Now there's a lot more. So, but that said, I was the only female in the department. I was involved in the clinical trials with Viagra. I was at the University of Maryland, and my attending was one of the primary investigators. So I was actively involved in that research, and I was thinking at the time, well, what about women? And what about, and I would go to the anatomy textbooks and go to my Netter diagrams and go to the gynecological literature and search PubMed and Medline. And there really wasn't anything that I could find that talked about sort of sexual arousal and enjoyment. It was based on reproductive function and ability to accommodate a penis, ergo not have pain. And issues of arousal, libido, enjoyment, satisfaction, orgasm, all that stuff certainly wasn't something that we as doctors talked about, much less thought about, much less researched. Yet we were doing it ad nauseum in the men and male models. And I worked from the bench to the bedside in men. So that's what sort of spurred this whole kind of movement. This talk that you're going to see here is a work in progress. Those of you who have known me, have heard me speak before, there are some of the same slides, but I add to it consistently, week by week, month by month, decade by decade, as new things come up, and as I, in my own personal journey and professional journey, learn new things. One thing I'm going to tell you, and hopefully it doesn't come as a surprise, but this is sort of my new epiphany. I'm turning 50, by the way, not in September, but I might as well be 50 already, I feel. But it's sort of like I have a new approach to life and to everything else. And really what I've found and in my patients, and also this is founded in science, there are NIH grants in this field as well, is the power that the mind has to heal. We've all heard about mind-body medicine and integration of mind and body. You've had psychiatrists here talking about neurotransmitters. I can tell you, and you can go and research yourselves, there are studies that show that changing the way that we think, changing our perception, minimizing stress, absolutely has a fundamental effect on the body and wellness. We all know about the placebo effect and how challenging that is, when we're doing clinical trials and having to enroll more patients in order to accommodate for the placebo effect. Taking the placebo effect, when we take something because we think it's helping us, it really does help us. So what does that mean, and what do you do with that information? And, it kind of hit me like a boom when I was walking around and circulating around the exhibit hall and seeing all the probes and the bells and the whistles and the supplements. This is really what has been, if you take nothing else away from this, and I'm going to give you a lot of information, you're hearing a lot of information, hear this. The way that we approach patients, the way, our voice, our tonality, our enthusiasm, our belief, this is something that I think is going to really help you. This is something that I feel is a benefit to you. This is why it's a relationship between the patient and the doctor. It's a level of intimacy that as a physician, as a surgeon, I was never taught. And my personality is not so touchy-feely. And I've had to evolve as a person, as a human being, in this field that you all are in. I'm sort of on the outskirts of it, but this field that you're in, you are required to have, in order to be effective, in order to get the outcomes that you want. I really urge you and implore you to switch your brains a little bit and think about, I call it the placebo prayer. If people believe that what you're doing, be it, a gadget, a pill, a supplement, something that really works, obviously, or, we don't know for sure how it's working. When patients buy into what you're doing, your outcomes are better. And that's exquisitely true in the field of sexual health because it's a relationship between the mind and body. So in terms of prevalence of sexual dysfunction in the United States, this was back in the late 90s, the National Health and Social Life Survey, over 1,749 women ages 18 to 59. They've now looked at women over the age of 59 experience some sort of sexual function complaint, with the primary one being loss of libido or loss of sexual desire. So right now, the estimates are about 64 million women in the United States are experiencing menopause, are going through menopause, are suffering with symptoms related to menopause, be it, hormone imbalance, vulvovaginal atrophy, any of the multitudes of symptoms that we're talking about today. Well, back in the 1800s, we called it something else. So the word hysteria, which comes from the Greek word the womb, when women become agitated, irritable, moody, we all know those patients, and we as women here in the audience have experienced that around our menstrual cycle. And as we become older, mid to late 30s, early 40s, approaching menopause, mood swings and irritability are extremely common. And this was, called back then hysteria. And the treatment for that, well, there's a Broadway play called In the Room Next Door, which I didn't see actually, which is unfortunate, but I read a lot about it. And it was about a doctor that would relieve hysteria, which was basically PMS, with sexual stimulation. He wasn't doing it in a sexual way, through vibrators. And the woman with her head to the door was the wife, who was sort of estranged from the husband as he's, pleasing these women, and they come back and back and back. And this is what the early vibrators look like. And they call them orgasms were called paroxysms, like paroxysmal, the word that we use now. So through orgasm, with the release of neurotransmitters, dopamine, oxytocin, and GABA, there's this sort of soothing and calming effect, as well as contractions of the uterus, which help with pain. Well, today, based on, what we've learned from the 1800s and how I've evolved in my medical practice as a urologist, as a surgeon, as a woman, I am now, and basically, if any of you are dealing with sexual health, have to learn to feel comfortable talking about sex, have to form your own boundaries of what how you communicate. But I can tell you this, if you don't ask, they won't tell you. They may tell you about their hot flashes and night sweats, but she won't tell you that she's lost sensation, or she has difficulty achieving orgasm, or the contractions aren't like they were when she was in her 30s, or after her hysterectomy she's noticed that she only has clitoral and not vaginal orgasms anymore. It's really important that you sort of form a comfort level talking about these things, and then being able to treat them. And medications and reassurance and placebo prayer can only go so far. Sometimes you have to pull resources outside. So these are ones, being comfortable with these. I don't sell them. I don't have my own line. I leave that to my sister. But I do recommend, different products, and I say why they work and how they work and why. I've even recommended male masturbators. I'm sure the guys out there have heard of the Fleshlight and the Tenga egg. And how I learned about them, ironically, is from the benefit of sexual stimulation and masturbation on prostate health. And the erotic toy industry sort of is now coming into mainstream America and doctors' offices. So